Our program today is about open enrollment with BLBB advisors and Move Health. I am Bonnie Bell. I'm the Director of Brand Management here at BLBB Advisors. Now, many of you have listened in on similar programs on this topic in the past presented by Caribou. Caribou was acquired by Move Health earlier this year and continues to provide the same quality of service for healthcare planning solutions to our clients. And we are proud here at BLBB to extend our reach through partnerships with third-party providers like Move Health to offer additional services that are responsive to our clients' needs. And as you know, financial planning frequently guides decision-making, but it relies on several assumptions, which include healthcare costs. So over the next 40 minutes or so, Move Health is going to guide us through the fascinating world of Medicare. And our speaker today, as you can see on our screen, is Christine Simone. She is the founder of Caribou and now partner with Move Health. She continues her dedication in helping our clients maximize healthcare costs to make better financial decisions. And I can assure you she has a unique talent for empowering individuals to navigate this complex process with confidence. We do have a large crowd with us today. So I ask you to use the chat feature at the bottom of your screen to ask any general questions throughout the program that Christine can address at the end of the presentation. Following the presentation, if you have any questions that are personal to you or you would like to engage Move Health Services, please reach out to your BLBB financial advisor so we can get that process started. All the registrants will receive a recorded copy of today's program that you can use as a resource afterwards because there is a ton of information. And if you like what you hear today, please reach out to me with suggestions for future programs that would be helpful to you, and continue to follow us on our website and LinkedIn. So with that introduction, I will turn it over to the person you are actually here to listen to, and that is Christine.
Thank you, Bonnie. I have one job today, and that's to make Medicare fascinating. That was the way you described it. So I hope that this is going to be fascinating, exciting for all of you. Hopefully we can get through some good content, some good education here today over the next 45 or so minutes. I just wanted to take a quick second to introduce myself, even though Bonnie already did. A lot of you, if you've engaged with BLBB's healthcare planning services in the past, would have known us as Caribou. We are now a bigger, stronger team, and there are some small changes, some good changes to the service offering as well, post-acquisition in January. So it's been already 9 months. You know, the craziness has settled down. We're now settled into our new home. And one of the great things that we can offer now is enrollment support in your chosen plan. So many of you, if you have engaged with us in the past, we've worked with, dozens, potentially, over 100 BLBB clients at this point. You would have known that we didn't do the actual enrollment at the end of the process. Now we can. In many cases, there's small exceptions to that. Maybe if you want a plan that might not be available to us, but for the most part, we should be able to help you from start to finish. So it is my absolute honor to continue to serve you all just now under this new brand of Move Health. And before we get started, I would love for us to just get accustomed to the chat. That way I know that you all feel comfortable using it. So if you don't mind, I would love to hear from you. You don't have to tell me your exact age, but is anyone here over 65? You can just put over 65 or 65 plus in the chat. Or is anyone here under 65 but just curious about Medicare? I would love to get a sense for the mix in today's session. So if you are comfortable using the chat.
Christine, I think the chat might be disabled, so let me work on that while you keep going.
Okay. Okay, chat is disabled. We'll see if we can get that going. I do see people being creative and using the Q&A instead, which works just fine. So we've got someone who's 64. Someone turned 65 yesterday. Happy belated birthday. That's exciting. We've got 64s. 68s. All right. Great crowd here. 71. Amazing. Two 71-year-olds. I'd love to see it. Okay, good. So we've got a good mix.
And the Q&A is working, so I do encourage people to continue to use that.
Yes, use the Q&A. Don't worry about the chat.
Yep.
So it looks like we've got a good mix of age groups here. We've got some people who are new to Medicare, 65 and 67, and we've got some people 66 in November, 62 and curious. Okay, love it. So we're going to go through a lot of the basics of Medicare because I do find that even people who have enrolled in Medicare, if they didn't get the level of depth of knowledge that we feel is important, they might not know how their coverage works, what other options are out there. So we're going to spend a good chunk of time today going through the basics. That includes Medicare drug plans. So we're going to cover traditional Medicare, Medicare Advantage, and Medicare drug plans. And then we're going to get into open enrollment timelines, what you can do and when. And then if we're still feeling like as engaged as we are now with the Q&A in the chat, we'll do a little test at the end, or I can just give you the answer as we go over that slide. So let's get started. Now, know that I have probably explained Medicare at this point hundreds, potentially even 1,000 times to people. So every time I walk through this, I say it a little bit differently. If you want me to repeat it, say it differently, slow down, speed up, again, use the chat, just let me know. I'm happy to be kind of eyeing it as I go through this to make sure that what I'm talking about in the present moment is resonating with you all. Okay? So many of you probably already know that when you enroll in Medicare, you have two options. You can either enroll in what's referred to as traditional Medicare, also known as original Medicare, or you can enroll in a Medicare Advantage plan. When you enroll in traditional Medicare, you are enrolling in essentially 4 different parts. And it feels like you are enrolling in 4 different parts because you have to sign up for Part A and Part B. That's done through Social Security. Then you have to add your Part D drug plan. That's done through a private insurance company. And then you have to add what's referred to as a Medigap plan or a supplemental plan. Goes by both names. And that's offered by a different private insurance company. So you are taking like 3 different steps to enroll in Part A and B together, Part D, and then Medigap or your supplement, interchangeable names for that. When you enroll in Medicare Advantage, you're just enrolling through one insurance company, and that is also called Part C. So this is what I like to refer to and the industry refers to as like alphabet soup, right? There's all these different pieces and parts to Medicare. What's important to know is that when you're enrolling in Medicare for the first time, this is your first big decision. I would also say your first big decision is when to enroll in Medicare. If you're still working, you can delay that. If you're not working and you turn 65, it is your only option. But other than when to enroll in Medicare, your next big decision is which way am I going to configure my Medicare coverage? Am I going to go the traditional Medicare route or am I going to go the Medicare Advantage route? And we're going to dive into both of these options in quite a amount of detail here over the next few slides. But first, I just want to make sure that you know that there are these 2 ways to set up your Medicare coverage. When you go with traditional Medicare and you sign up with the part on the left hand of your screen, you have this coverage essentially for life. The Medigap plan you pick is the plan that will likely carry with you for the rest of your life. Your Part D plan you can change every year, which we're going to talk about later in the presentation. But it's that Medigap plan that makes it harder to change in the future, because if you ever want to change it in the future, you have to go through medical underwriting to change that plan. When you enroll in Medicare Advantage, you can change that plan every single year, no questions asked. If you wake up and decide one day you're on Medicare Advantage and you decide you want to go into traditional Medicare, you would be subject to that underwriting for that Medigap policy. But the reverse is not true. If you're on traditional Medicare and you want to go on Medicare Advantage, you can do that every year during open enrollment. So what I want to make sure you understand on this side specifically is that you're sort of piecing together different parts to Medicare with traditional Medicare versus Advantage, where it's an all-in-one option. And then if you ever wanted to switch in the future, it is easy to switch to Medicare Advantage, but it is challenging to do the reverse, to switch from Advantage to traditional Medicare. And in a few slides, we're going to go through the nuance of why you might want to switch, what the differences are. But that's the most important thing to get across here on this slide at this moment. Oops. Okay. Now, in both cases, whether it's traditional Medicare or Medicare Advantage, you do have Parts A and B. So I know it wasn't listed on that slide under Medicare Advantage. It didn't say Part A and Part B, but that's because it's provided by that private insurance company that you choose when you enroll in Medicare Advantage, but you still have it. So both options have Part A and Part B. Part A is going to be your hospital coverage. Think inpatient hospitals, skilled nursing facilities, home health care, hospice care. And generally speaking, you pay $0 when you enroll in Medicare Part A as a premium. It's a $0 premium a month. Exceptions to that are only if you have not paid your Medicare taxes for more than 40 work quarters, or at least 40 work quarters, meaning 10 years. So if you or your spouse, who you're married to and have been married to for a particular amount of time, have not paid those taxes, then you could be subject to a premium for Part A. And it's going to be dependent on how long you've paid those taxes for, if at all. Your Part A plan has a deductible, but it doesn't work like a regular deductible that resets every year. This deductible of, in 2025, it's $1,676. This deductible is per benefit period, which means that this period begins when you are admitted and ends if you haven't received any inpatient care for 60 days consecutively. Okay, so it's not like an annual thing. It is based on admission to a hospital, a skilled nursing facility, or a facility like that. It's going to cover 100% of approved home health care, hospice. It's going to cover days 1 through 20 of your skilled nursing care. Beyond that, you would pay a daily fee. This year, it's $209.50 a day. Part B is going to be your medical services. So think like your routine healthcare, doctors, outpatient visits, labs, tests, vaccines, things like that. Everyone will pay a premium for Part B. It starts at $185 this year, but you will pay an adjustment on your Part B premium based on your income from 2 years prior. I'm going to show you a table on the next slide that tells you where you fit in that income adjustment. But basically, Social Security and the IRS, they know what you made 2 years ago. So in this year, they're looking at 2023. Next year, they're going to look at 2024. And they're going to say, based on your income and your tax filing status, you are going to pay an extra X amount of dollars on top of your Part B premium. You are subject to a deductible for Part B, $257 a year, and that's per calendar year. And then once that deductible is met, if you only have Part A and Part B, you would be exposed to 20% of costs for every single service that you access. So Parts A and Part B only cover 80% of your costs, which is why you have that Medigap plan that covers the gap that Parts A and B don't cover. So we're not going to get there quite yet, but we are going to cover that Medigap plan in detail. Just know that if you only enroll in Parts A and B, you would only have coverage for 80% of your costs. I mentioned IRMA on the last slide as an adjustment to your Part B premium. It is also going to be an adjustment on your Part D premium. I'm not going to quiz you on this, but IRMA stands for Income-Related Monthly Adjusted Amount. So the acronym itself does make sense. It's that adjusted amount on top of your monthly premium based on your income. Okay, very creative, Medicare, in their naming of different things. This is your modified adjusted gross income. It is determined by Social Security. Again, they coordinate with the IRS. They know what you made 2 years ago, but you can appeal this determination. So there is a form. It's called SSA 44. If you Google it, it'll be the first Google link that pops up. And you can essentially say, I used to make this amount of money, but I don't anymore. Maybe you retired. That's one of the most common and one of the strongest reasons to appeal your IRMA determination. If you tell Social Security that you sold your house and you made a ton of money, but now you don't have that as annual income, they're not going to care about that. They're going to care more about like your lifestyle and your income that you were generating regularly, and that there's been a change to that. So the way that you read this table here on the right-hand side, and these are all 2025 numbers because we don't yet have the 2026 numbers, is that you would find your tax filing status here in the light blue columns. So if I filed a joint tax return with my spouse, then I would look in the second column, and then I would find our income. I would go, down to where maybe we make $350,000 a year, and then I would come across and my Part B premium would be $480.90 a month. So $480 a month I'm paying for my Part B. And then for Part D, which is my drug coverage, we haven't covered that yet, but this is going to be the premium of the plan plus an extra $57. So Part D has its own premium based on the plan you pick, and then I'm going to pay an extra $57. So if I'm comparing myself to maybe somebody who makes $200,000, I'm paying, an extra, what is that? $350 a month in comparison. And this is individual. So even though I file a joint tax return, this is just my individual premium. My spouse, because I filed joint, is going to be paying that same amount. So, you double this. So in comparison to a couple here in the first row, you would be paying an extra $700 a month. Okay, so these numbers are all subject to change. Usually it's, September 30th right now, usually hopefully by open enrollment, October 15th, we have these numbers, but there have been years where they have held on to these for like a week past open enrollment. So you might not know. If you're already on Medicare, for those 71-year-olds that were in the chat, 68, I saw some 65s, some 67s, you will get a notice in November that tells you what your IRMA for next year will be. And if you have means to appeal it, you've got to appeal it quickly before the end of the year. Ideally, do it within 30 days, okay? So I've covered that Medicare Parts A and B don't cover 20% of costs. And then I mentioned to you that that's where that supplement or that Medigap policy comes in, or you can choose to enroll in a Medicare Advantage plan. Now we're going to really dive into the differences between these two options. I mentioned on that very first slide that there were differences between traditional Medicare and Medicare Advantage, and here's where those come into play. Either way, you're going to get that coverage for that 20% that parts A and B don't cover. The difference is that with a supplement or Medigap policy, you will pay a monthly premium of usually anywhere between, I've seen like $120 a month, all the way up to like $500 a month, depending on where you live and your age. So you will pay an additional premium for that Medigap plan. But you have the freedom to essentially go to any doctor or hospital in the whole country. That is one of the biggest differences between those two options. Any doctor that accepts Medicare as payment in full will take your Medigap plan. So if you are going to a doctor today and you're not yet 65, ask them a question of, do you accept Medicare? And if the answer is yes, you know that you can continue to go see that doctor after you enroll in Medicare. There's like 2% of doctors, most of which are concierge medicine doctors, so they only accept direct payment. They don't accept any insurance, that will not accept this plan. So typically speaking, I think the data says that 90 to 8% of doctors and hospitals across the country you can walk into. You don't need any referrals. You are accepted anywhere that Medicare is accepted. You also don't have, depending on which Medigap plan you pick, but you also don't really have copays or coinsurance. So once you hit that deductible of $257 that I mentioned on the prior slide, this plan would pay 100% of the remaining costs. You do have to add a separate drug policy though, okay? The alternative option is to go with Medicare Advantage, and you would pick one insurance company to provide this coverage to you. Usually it is low or no premium, so you see lots of $0 a month in Medicare Advantage plans, but you will have copays and coinsurance, and you will have a larger out-of-pocket maximum in most cases. Not always. I don't think I've ever seen a $257 out-of-pocket cost with Medicare Advantage, but I've definitely seen like $500, so not quite different. But in most cases, it is $2,000, $3,000, $4,000, $5,000, $6,000 in terms of out-of-pocket costs on a Medicare Advantage plan. That again will vary depending on where you live. Off the top of my head, unfortunately, Pennsylvania, I'm not quite sure, but it's definitely not like Florida, where in Florida we've got like $500 out-of-pocket maximums. It's probably closer to the $2,000, $3,000, $4,000 range in Pennsylvania. I think the more important, bigger difference, personally, is that you are restricted to the network of doctors that this plan accepts. very similar to your employer-based coverage or to the coverage you had if you were ever on the exchange or Penny in Pennsylvania, where you had to, every time you went to a new doctor, log into your portal, make sure they're covered by that plan, and then, even call the doctor's office, make sure they accept your plan. That's the sort of kind of behavior you have to have with a Medicare Advantage plan. Sometimes you need referrals to see a specialist. If you're on a Medicare Advantage plan, because it has that network, you will see those acronyms that you may have been familiar with previously, like HMO or PPO. So depending on which kind of plan you enroll in, you might need a referral to see a specialist. And although you could have some additional benefits like vision coverage, dental coverage, even transportation. I've seen plans with fitness benefits to like the YMCA, hearing aid benefits. So you might have some additional perks included in this plan. So if I could summarize this in, just a few words, a Medigap plan, more freedom, more expensive. Advantage plan, more perks, lower cost, more restrictions. So that's really the big difference between these two options. There are good options in both buckets. So I don't want to discourage you or feel like I'm encouraging you for either option. It really comes down to your own personal preference and what you feel is important to you. But if I take it all the way back to the first slide, again, I'm not going to test you on this, but if you enroll in a Medicare supplement or Medigap initially, you have this plan for life. If you wanted to change your Medigap plan, like from one carrier to another, there wouldn't really be a reason to do that, but you could. You would have to go through underwriting. But if you ever woke up one day and you decided, I really want, the perks of Medicare Advantage or all my doctors are a network, you can do that, no problem. But if you first enroll in Medicare Advantage and you want to do the reverse, you have to go through underwriting to get approved for this policy. And if you don't get approved, we wouldn't suggest you drop your Medicare Advantage plan and only have Parts A and Part B because it only covers 20% of your costs. So you're better off just staying on that Advantage plan. So a lot of times later in life, as people's healthcare needs start to ramp up, costs start to ramp up, the providers they want to see, or there's a bunch of new people they want to start to see, that's when you would maybe want to switch. And that's when you would not get approved through medical underwriting because you have these underlying health conditions or needs or things like that. So do keep that in mind for those folks who are here and new to Medicare, or for anyone who is enticed by the advertisements that they see or their neighbor who raves about their Medicare Advantage plan. Just keep those things in mind. This isn't, unfortunately, just a decision you make once a year and it's a fresh new decision every year. There are some longer term implications of those decisions. So let's dive even a little bit deeper into these Medigap plans. For the most part, I think, most clients that we work with, including most clients at BLBB that we've worked with, have enrolled in a Medicare Plan G. There are also Plan Fs for anyone who turned 65 before January of 2020, which there's 2 people in here, at least that told me their age, that might be on a Plan F, but it's no longer available to people. The Plan F basically mirrors the Plan G. The only difference is that $257 deductible. So it's not a very big difference. Plan F's not available anymore. And if you're on a Plan F, what they've actually done is they've hiked those premiums so high that you could be paying more than that difference in deductible, that $257 a month. So it could be worth exploring switching to a Plan G. Some carriers might take you without underwriting because you had a Plan F before. So it is always worth exploring that and just reevaluating your coverage in the event you are on a Plan F. But for the most part, Plan G is what most people are on. It is the most comprehensive coverage. This is going to be secondary coverage to your Part A and B, and this is going to be with an insurance company that you choose. So when you enroll in Medicare, you will choose a Blue Cross Blue Shield, a Cigna, a Humana, an AARP, United plan. So you will choose a plan with a carrier. We don't have to go into the details of these benefits, but just know that Plan Gs are the most comprehensive coverage and that every Plan G is created equal. There are some small nuance to that. We're not going to go in it today, but for the most part, the base benefits here on this table are all created equal. So if you have a Plan G through Humana, or you have a Plan G through Cigna, or you have a Plan G through United, those are all going to be the same basic benefits as they are listed on this table. So this is a level of detail that I don't typically go into or suggest that even Medicare beneficiaries really need to understand. But just know, again, if you are considering other letter options for you for Medicare, then speak to one of our team members, talk to somebody who's an expert. We can dive into this level of nuance with you if you are looking to explore these different options. Something to make note of, you see a column with A and you see a column with B and you see a column with C. These are not the Part A, Part B, and Part C I was talking about earlier. These are Plan A, Plan B, and Plan C. So again, just further complicating all the nomenclature in Medicare, not to be confused with what you've already enrolled in, which is Part A and Part B. And then if you're on Medicare Advantage, Part C. These are Plan A, Plan B, Plan C. These are supplement or Medigap options that you choose if you're going the traditional Medicare route. Okay, Plan G, again, is going to be your most comprehensive coverage. Some people might still have F available to them. Both F and G are available too in high deductible options. So that would mean that you're not paying that $257, you're actually paying, I think it's $2,800 this year at least in a deductible. You'll have a lower premium, but you'll have a higher deductible. Again, you want to think long term, because if you ever wanted to change that in the future, you would have to go through underwriting. So keep in mind that again, this is a decision that you're making long term for those who are first enrolling. For my folks who are here, who are already on Medicare, who might already have a plan available, or a plan that they're already on rather, you can change this every year. If you're curious about exploring options, curious if you could pass medical underwriting, that's something that our team could help you with, because it's always a good idea to reevaluate this every so often. It could be that the carrier that you're on has hiked their premium significantly, and maybe another carrier will take you with or without underwriting because you've already have your Plan G established and they just want your business. So always worth bringing this up with one of our team members. We can look into other options for you and give you a sense for what other options exist. We've got here a screenshot of our analysis. This is what we do for clients as they're exploring their supplemental plan options, whether it's open enrollment or it is your initial enrollment in Medicare. You can see here 3 different options, one by Globe Life, one by AARP, and one by Everence, which is Blue Cross Blue Shield. We've got premiums of $176, $190, and $116. Why is this one on the right so much lower? Well, that's because it's a high deductible Plan G. So your deductible is $2,870 as opposed to $257. So the premiums are usually lower. One other thing worth noting is when you're enrolling in a supplement, there's a few different ways that they price those plans. One is based on your age. So you will expect it to increase every year because you're getting older. The other way is community rated, which is based on the total pool of people that they are insuring. So as you get older, hopefully they're adding younger people to that pool, and so it's keeping your premium more consistent. It will still go up with inflation, but it is hopefully keeping your premium a bit more consistent as you go through the years with that plan. So those are things that we look into. That's what we encourage people to look at, again, because the benefits are created equal depending on the letter that you pick. So there's not much else to look at other than that. If you don't go the supplement route, that means you're going the Advantage route. I've already explained a lot about Medicare Advantage in regards to those networks. Here, I just want to reinforce the point that you will have a network that you will be subject to. And if you're on an HMO plan, it means your care is coordinated by your primary care physician. You have to get a referral to see any specialist, and you don't have any out-of-network care. If you're on a PPO plan, usually you don't need a referral to see a specialist. You have more choice of your providers. You can see out-of-network providers. It will cost you more, but you can see them and there will be some coverage for them. But you will probably have a slightly higher premium for that. I don't see many $0 PPO Medicare Advantage plans, but it's very well possible. That is the biggest difference. Again, these networks, who you can see, your flexibility, that is the biggest difference between these plans. A few extra things that I've mentioned just to reinforce, those additional benefits like dental and vision do come with most Medicare Advantage plans. You can sometimes get transportation benefits, fitness benefits, things like that. You might have higher rates of denials for services or needs for prior authorization. And remember that Medicare is covering your skilled nursing facility care as well. So if there's a skilled nursing facility that you want to go to in your area, it would be subject to whether or not that Medicare Advantage plan covers it versus traditional Medicare, you do have more flexibility. So I know it's hard to think long-term, but that is how you want to be thinking when it comes to making your initial election or if you're considering a switch during the open enrollment period. Again, there are lots of people, actually, in some states, more than half of people are happily enrolled in Medicare Advantage plans. Well, actually, I won't say they're all happily enrolled, but it is a very common option. People do really like this coverage, but just know that it does come with those extra restrictions. When you are looking to evaluate your Medicare Advantage coverage, it is a lot more nuanced, right? It's not as simple as the supplemental coverage. It is a lot more nuanced for a variety of reasons. First, you have the network type. So in that first row, you can see HMO or PPO. You then want to compare the premium. Here we have some $0 options, and then we have ones that are $17 and $90. And then you want to look at the out-of-pocket maximum too. Add those two together, annualized, and you get what we call our annual financial risk. So you can see here that, the plan in the third column, because it has the biggest out-of-pocket maximum, it has the biggest potential risk for you every year. Whereas, columns 1, even 3 and 4 are all pretty comparable. That's purely the financials. But you also need to know which doctors are in network. So do they accept my doctors in my hospitals? And then you also need to know your estimated drug costs of these plans, again, because it's all bundled together into one. So you need to, look up or work with us to find what the cost of your medications will be on that Medicare Advantage plan, because it can differ. You can see the same medication here costs a different amount of money on the other plans, on each plan. That being said, this is an inexpensive medication, but the difference can be quite drastic with other medications. So there's lots to look into here as you're evaluating the different options for your plans. There is a great question in the chat that I do want to cover just now because it's relevant. Is Medicare Advantage subject to IRMA? The answer is yes. So you can see it here in this table too. Thank you. I would have glossed over it. IRMA for Part B and Part D will apply no matter which way you go. So you will not save any money from that perspective. They will have you pay that adjustment on both your Part B and your Part D income. In this case, it looks like it's $0. If this is a couple or an individual that made less than $212 for individuals, or I think it's like $106 or rather $212 for a couple, $106 for an individual, then they wouldn't be subject to IRMA for either Part B or Part D. Great question. I touched on Medicare drug plans there with Medicare Advantage because it's impossible not to. That coverage is usually embedded within that coverage. But I want to now broadly take a step back a little bit and just describe how Part D drug coverage works, whether you have it through traditional Medicare or whether you get it through Medicare Advantage. What you need to know. Part D plans, if you enroll in traditional Medicare, is provided by a separate insurance company from your Medigap coverage. So you are dealing usually with 2 different insurance companies. If you enroll in Medicare Advantage, your plan may or may not include drug coverage. We advise that you pick one that does. The only exception to that, and there is a question in the chat about this as well, is if you have coverage offered through the VA or TRICARE or a spouse's employer who's still actively working, or maybe your employer and you're still actively working. If you have COBRA coverage, it does not qualify for what's called credible coverage per Medicare standard, meaning that if you wanted to enroll in a Part D plan later in life, 2 things will happen. 1, you can only enroll during open enrollment. So if you got a new prescription in like July, and you think, I'm just going to enroll in a Part D drug plan now, you cannot do that. You have to wait until open enrollment, and your coverage would go into effect January 1st. Second, they will penalize you for every month you did not have Part D drug coverage once you enroll. It is a pretty nominal fee, I don't know the calculation off the top of my head, but I've seen people with, a couple bucks added to their monthly premium. I've seen people with $10 to $20 added to their monthly premium. I think that's just about as high as you can possibly go, but it is something that carries with you for life. So you will pay an additional, call it $5 a month, $10 a month for the rest of your life if you go years without Part D drug coverage. This premium for this plan will also vary from plan to plan that you pick. So a carrier, like let's use WellCare as an example, it's a very common carrier. WellCare will offer 3 different prescription drug plans in most markets. All 3 of those plans will have different premiums. All 3 of those plans will provide different pricing for your drugs. Even though if you entered the same drugs for all 3 of them, they could provide different pricing for all 3. So you are enrolling in a separate plan for this Part D drug coverage, or it's included in your Medicare Advantage plan. There didn't used to be a cap on what you could spend for Part D, but now there is. So in 2025, this year, there was a cap introduced. It was $2,000. Now next year, it's going up to $2,100. It's the only number we know Medicare related for what's happening in 2026. So this is going up by $100. This cap does not apply for non-covered drugs. So if you take a medication that is not covered by your plan, this cap does not apply. You will pay unlimited amounts for however much you need to refill that medication through your, well, it won't even be through your plan because your plan does not cover it. So out of pocket, you would pay those costs. So this is only for covered medications by your plan. So there's kind of 2 things you need to keep in mind here. Medicare has a list of drugs that they cover, but not all plans cover all Medicare approved drugs. So you want to make sure that your plan specifically is covering that drug. As a very good example, these GLP-1s, a lot of plans are starting to cover them now to be competitive in the market and to entice people to come to their drug plans, but not all plans are covering some of these GLP-1s. So it's a really good kind of example to point out. There's a question in the chat, but I'm going to save that one for later just because it's a broad question and kind of walk through this Part D stuff first. So when you're comparing your Part D drug plans, there's a few things you want to keep in mind. Obviously, the premium of that plan matters, but not so much. So these plans are anywhere from $0 to, I think the most expensive one I've seen is maybe $70 a month. It will depend on where you live, but usually speaking, people are paying like 15 bucks or less a month for these plans. All the more reason, if you don't have any medications, enroll in one that is, less than $5. There are even $0 premium plans depending on where you live. So you want to take the premium into mind, but it's not the most important thing. The more important thing is what is the price of your medications at the pharmacy that you go to on that plan. So when we work with clients, we ask you to fill out a profile. That profile will have all of your medications. You will add all your medications. You will also tell us which pharmacy you go to, and we can provide an estimate of what we think your drug costs are going to be on that plan at that pharmacy. And that is the most important thing. You can also look at the plan's deductible. Sometimes important. Again, usually it's anywhere between like $0 to a couple $100. So sometimes it makes a difference, sometimes it does not. Depends on how expensive your medications are. Part D IRMA will apply no matter what. So your Part D IRMA will be built into this calculation too, if applicable. I already mentioned this, but just to reinforce, if you don't take any medications, please do not omit enrolling in a Part D drug plan. We would never really advise it. We want to make sure that you have the coverage in the event that you do get a prescription medication. You can, in most cases, pick a plan that is anywhere between $0 to $5 a month. Otherwise, you will be subject to those late enrollment penalties. But potentially even worse, if you do get prescribed a pretty expensive drug and you don't have drug coverage and it's not open enrollment, you have to wait until the end of the year to get that coverage. If you do have TRICARE VA coverage or coverage through a spouse who is still actively working, then that can provide your drug coverage. It can also provide your medical coverage and you can delay your Medicare altogether. But that is really those are really only the other sources of credible drug coverage. And then if you are considering Medicare Advantage, make sure it does have that embedded drug plan within it. So now that we've got all of those basics down pat, we've got 20 minutes left in the hour we have together, and I'll make sure I save time for questions. This is now the easier part of the presentation where I'm going to tell those who are already on Medicare, and for those who are new, what to expect, what you can do during the annual enrollment period. So the annual enrollment period runs the same time every single year, even if it's a Saturday. October 15th to December 7th is when you can essentially change up your coverage. I'm going to walk you through exactly what you can do. For the most part, if you're on traditional Medicare, meaning you have that Part D drug plan, that's what you're looking to change every year going forward. And we do recommend you do it every single year, because even if your prescriptions haven't changed, your drug formulary on your plan will change every year. That is the most typical kind of engagement we get during the open enrollment period, because most of the clients we work with are on traditional Medicare. You can, though, just so you know, switch from original Medicare to Medicare Advantage and vice versa. But hopefully, if you're listening, you know that if you want to switch from Advantage to original Medicare, you would be subject to medical underwriting for that Medigap plan. If you're on Medicare Advantage, you can switch your Medicare Advantage plan every year, no questions asked. And we do recommend that you look at that every year, not only because of the medications, but also because the provider networks. So the provider networks will change every year as well. So you want to make sure that you're looking at that too when you're reevaluating your Medicare Advantage plan. You can also switch from a Medicare Advantage plan that doesn't offer drug coverage to one that does, and vice versa. Again, we typically don't recommend that you go without drug coverage. If you don't have a Medicare drug plan, you can also join a new drug plan as well during this time of the year. Don't worry about memorizing October 15th to December 7th. Even for as much as I talk about this, sometimes I mix them up. I say October 7th to December 15th sometimes. Just remember the month of November. It's the easiest thing to remember. If you get this done before Thanksgiving, you've done your job. That is the easiest way to think about this. Most people who say, I'll deal with it after Thanksgiving, forget that it ends December 7th, and then Christmas rolls around and they weren't able to change their plan. So this is truly the only time that you can change your Part D drug plan. So if you're on traditional Medicare, just remember the month of November, get it done before Thanksgiving, and you don't have to worry about missing any timelines. For anyone who's on Medicare Advantage, if you missed that timeline because you got so bogged down by the holidays and all your family and so on, you have an extra 3 months to do it, which is good news. So you do have all of Q1, the first quarter of the year, to be able to switch your Medicare Advantage plans. You can switch that up. You can also switch from Medicare Advantage to original Medicare and join a separate drug plan, but you cannot do that if you're on original Medicare already. You can't just switch your drug plan if you're on original Medicare. During this time of the year, it's also what's called the general enrollment period. So if you're past 65 and you missed your initial enrollment in Medicare, this is the only time that you can pick up Parts A and B. And you need Part A and B to enroll in a supplement and a Part D drug plan or an Advantage plan. So you can also do that during the first quarter of the year. You cannot switch from original Medicare to Medicare Advantage. You cannot join a drug plan if you're on original Medicare, and you cannot switch a drug plan if you're on original Medicare. So much more restrictive. Again, if I could encourage you to do one thing, it would be to reevaluate your coverage here, because you can do everything you need to do here. Then you don't have to worry about what you can and can't do in the new year, with the exception of if you're past 65 and forgot to enroll or made a mistake, didn't enroll. This is the only time of the year that you can pick up Parts A and Part B. And then you would follow that with additional coverage. Hopefully that was very clear in terms of what you can do and when. And the last thing I'm going to leave you guys with before we open up to some questions is, hopefully you were paying attention to the differences between these two options. If you're willing to participate, write in the chat. I'm going to walk you through this financially, but this is missing a lot of information. If I look at traditional Medicare and I look at Medicare Advantage side by side, I can see here that you pay $0 for Part A in both cases. There would never be a case where you pay a premium for Part A for one, but not the other. Then I've got my Part B premium. My base premium is $185, but you can see the subtext there. I'm paying an extra $100 in IRMA because of my income from 2 years prior. On the left, for traditional Medicare, you see the premium for Medigap. It's $195 a month extra that I'm going to be paying. And then I have my Part D premium, which is $7, and I have an income adjustment also on that $7, an extra $45. It's $532 a month. But because of my Medigap plan, I only have an out-of-pocket risk of $257. Add that all up, annualize it, $6,641 is what I could spend every year on my Medicare coverage. Look on the other side of the screen, you still have $0. You've got that $185 plus $100 IRMA. My Advantage plan, though, is $0 a month. I still have my Part D IRMA, 45 bucks added into there, but every month I'm only paying $300. So I'm saving a good $232 a month. I feel good, but my out-of-pocket risk is $2,500. Comes out to $64.60. Not too different, right? This is a $200 difference between the two options. I purposely created this slide so that they came out to be quite similar. But if you've been paying attention to me for the last 46 minutes, what is not pictured here? What is this pure financial comparison not showing to, you if you were looking at this from like a pure financial perspective? Any guesses? Let's see in the chat. Drugs, yeah, drug costs. So Bob says drug costs on Medicare ADG, which might mean Advantage. So the drug costs would be true of both. So both, I'm not showing you what the cost of my medications would be on either plan, which can vary drastically depending on what you've enrolled in. Anything else? Okay, we'll skip to the answer. It's probably been a long time since you guys have been in school, so I don't want to force you through a test. But we've got provider networks, drug formularies, drug costs, any rate increases, the carrier stability. Is this a carrier that's going to be here in the market for a long time? IRMA rates were there, any other additional out-of-pocket costs, co-insurance, co-pays, deductibles on the drug plans, things like that. So there's so much that goes into your evaluation of Medicare. So my point with that slide is if you see an advertisement, what you're going to see in advertisements is you're going to see $0 or you're going to see additional perks and benefits. It's not just a pure financial decision that you are considering when you're enrolling in Medicare. Or if your friend's telling you about something, your neighbor, a family member, one important thing to note is if we ever meet a couple and they have the exact same plan, probably one of the two of them is on the wrong plan. So Medicare is highly personal to you, your healthcare needs, what's important to you, and the type of coverage that you want to have. So do keep that in mind, that there's so much that goes into this evaluation. And that's why BLBB has partnered with us. That's why we're here to help you do this evaluation of your Medicare coverage every single year. We will cover supplements with you. We will cover Part D drug plans. We will cover Medicare Advantage plans. If you're on traditional Medicare, we also have vision and dental policies, even travel policies that we can help you with because you won't have those offered like you would if you are on an Advantage plan. We also do this same great work for anyone under 65. So for those people who are under 65 and curious and join this, if you are retired or thinking about retiring or planning your retirement before you turn 65, we can help you evaluate your COBRA coverage to the individual marketplace and some other options too. So keep in mind that we can do this across all age groups and help you guys really optimize your coverage to make sure you're on the right coverage for you and your specific personal needs. With that, this was a delight to cover these basics for you. Hopefully it was fascinating, as Bonnie said, and I know we've got a few questions here in the chat that I'm going to cover. And Bonnie, I don't know if you want to moderate that or just let me sort of go through them and pick.
I think you going through and pick works.
Okay. Okay, sounds good. So one just came through here. Does IRMA notification that comes in November come in the mail or email? So that's a great question. I know it comes in the mail. I know for a fact it comes in the mail. I do not know if it also comes by email. So that's a really good question to verify, but know that it will absolutely come in the mail. So definitely be checking the mail for that. I think you can also log into your Social Security account and possibly see it there too. So you should, though, know based on your tax return, roughly what you're expecting. And you can reach out to Social Security in the event that you don't get a notice, but it should be coming in the mail for certain and may also come via email. Another question. If I'm covered by my wife's policy with her employer until she retires when I'm 75, I don't need to enroll in coverage until then. That's a great question. So the answer is, unfortunately, it depends. So typically speaking, most employers will provide you with what Medicare calls credible coverage, and that will allow you to delay your enrollment in all of Medicare, even Part A and Part B. If that is credible coverage, then you can absolutely delay your enrollment in Medicare. What I want you to think about is first check with HR to ensure that that is credible coverage. They will know exactly what that question means. They will know that you would be able, they would provide you with some notice or a letter that confirms that is credible coverage. But what I want you to consider is if you pay anything for that coverage, a lot of the times employers will have maybe different rates for people 65 plus. They will cover spouses differently. It might not be as advantageous as the actual working spouse. Just know that we can help you do a comparison to see what Medicare could cost you. And there are plenty of cases that we see where Medicare is less expensive. You would, though, be subject to IRMA. So depending on your income and the earning potential of your spouse, you will have that IRMA adjustment baked in. So it could be that it might not be more cost effective. It really depends. But if your wife's coverage is credible coverage, then yes, you can absolutely delay enrollment. One of the things I did not mention is as soon as you enroll in Part A, you can no longer contribute to an HSA. So we see a lot of people as well, delay their Medicare enrollment because they have a spouse still working, because they're also still contributing to that HSA. So that would be one reason as well why you might want to delay. Question here, you covered TRICARE and Part D, but what about as Medigap coverage? That's a great question. So this question is referring to, TRICARE can provide drug coverage, but what about medical coverage to supplement the Parts A and B that Medicare don't cover? And it can absolutely provide that coverage for you. You would be limited to specific facilities, TRICARE facilities. So it is, again, a very personal decision that you would want to make based off of your individual needs, the types of doctors that you see, and where you would want to be able to receive care. So we do typically suggest that when you're first eligible for Medicare and you have TRICARE or veteran coverage, or even a retiree health benefit package, that you consult with our team so that we can explain to you the differences between the two options, because you would, if you ever wanted to in the future, switch to Medigap, you would be subject to medical underwriting. Medigap will give you more flexibility to the doctors that you would be able to see. So that is, the biggest difference. But TRICARE and Veterans Affairs coverage will absolutely provide that medical coverage for you. And we'd be happy to help you kind of make sense of that too, if you have it available to you.
Christine, on the Q&A side, we have them coming in both sides, Q&A and chat.
Okay.
We have, if you relocate and your Medicare Advantage plan isn't available at your new location, how long after moving do you have to enroll in a new plan?
So my belief is 60 days. I always like to say to keep it safe, just because some of these differences, some of these, depending on what the life event is, you might have a different timeline. Try to do it within 30 days. As soon as you have that new address, that's when the time starts ticking. So you want to make sure that hopefully within a 30-day, but I think it's about 60-day window, you get to reevaluate that Medicare Advantage plan. That also applies for traditional Medicare too. Although your supplement can move with you because you're accepted by any doctor and facility, it can move with you. If you move out of what that plan calls the service area, you could have the opportunity to enroll in a new Medigap policy too. So if you're moving, try to get ahead of it. I know you've got a lot of stuff probably going on, but if you are planning to move, we can help line that up for exactly when you're looking to move.
Great. As we close out the hour, I can also address one of the last questions, which is basically like what happens next. So you have access to Move Health as a client of BLBB through BLB. So you contact your BLBB advisor to get the process started and make that introduction to Move Health and Christine. And then Christine, can you give us just a quick overview of what happens once that introduction has been made?
Yes. So your advisor will essentially sign you up for an account. So there isn't necessarily an introduction made to an individual, but they will sign you up with an account. With that account, you have two things that you can do. You can fill out your profile, which we highly recommend doing, and then do that before you can book a call, which is the other thing that you can do. If you are looking just to reevaluate your Part D coverage, we can actually do that fully virtually without a call. So when you submit your profile, you will get an analysis back and you can look at the different comparison. If you have any questions, you can absolutely still book a call. But if we're recommending the same Part D drug plan that you already have, then you don't need to book a call with a member of our team. But if, of course, if you have any questions or you want to talk through any of it, then you can absolutely book a call. So once you get that account, your advisor will set you up with it, log in, fill out your profile, see the analysis results, and then book a call if you've got questions.
Okay, and there was one that we missed in the chat, which is how does transition work with current medical plans for Medicare plan? What happens if you have already scheduled tests, meds, etc.? And is the onboarding process turbulent if one is pending tests?
Good question. So typically speaking, if you're a patient at a doctor's office before you become Medicare eligible, then your care will continue on. It really should not be turbulent. You will have to update the office with your Medicare number, your new Medigap plan, and the pharmacy will need your prescription drug plan. So you will have to go through all of that. But hopefully we're lining it up. I think, Bob, you had said you were 64. So I think hopefully we're lining it up with you getting that card and that number in the mail the month you turn 65 so that you can take it to the doctor's office and ensure that you have it. Now, depending on what kind of coverage you have right now, if you're employer sponsored, you have a period, a window of time with Medicare to enroll up to 3 months past your birthday month. So you might want to delay your enrollment. Maybe you've got a test the month after and you just want to have it all bill through your employer coverage if they're still covering you. If you're on the marketplace, you don't have that luxury, unfortunately. So the luxury, the marketplace plan will stop the month you turn 65, and your Medicare coverage needs to go into effect. So the best thing I can offer as advice here is make sure you're applying for parts A and B as soon as your initial window opens, which is 3 months before the month you turn 65. That way you have your Medicare number in place to be able to enroll in your coverage for the month you turn 65. That way there is no waiting around or interruptions. The Medicare Part A and B numbers can take up to 6 weeks in some cases. Usually it's 3 to 4, but it can take up to 6 weeks. So start that process early.
Okay, that about covers it. Christine, thank you again for taking this time to help walk our clients through this kind of moving part type of program here. Again, if you do have any questions in general, please reach out to your BLBB advisor so we can get that process started and introduce you to Move Health. If you have other topics, as I mentioned in the beginning of the program, that are of interest to you that you would like BLBB to present, please let me know. Everybody have an enjoyable day.